Welcome back to your favorite Nutrition Medico channel. The topic of this video is metabolic syndrome, diet, and exercise. Today I'm going to talk about metabolic syndrome, a controversial medical topic. Internet including YouTube is full with information and misinfo. You deserve to know what actually metabolic syndrome is, its treatment and reversal process. Foremost and the most important thing to know about metabolic syndrome is that it's not a disease. Rather, it's a group of risk markers that increase chance of catching cardiovascular diseases, diabetes, and stroke. As its name suggests, people with metabolic syndrome have a dysfunctional metabolism. Metabolic syndrome shows no symptoms. To diagnose it, blood glucose level, cholesterol level, and blood pressure level are checked. You have metabolic syndrome if you have at least 3 of the following risk markers. 1. A waist measurement of at least 40 inches for men and 35 inches for women. The measurement is not taken at waist level. Measurement is done across belly. 2. High blood pressure of more than 130/80 of a millimeters Hg. If your blood pressure is lower than 130/80 but you are taking blood pressure lowering medicine, then you still check this risk marker. 3. Having triglycerides level of more than 150 milligrams divided by DL, or taking cholesterol lowering medicines. 4. HDL cholesterol level of less than 40 milligrams divided by DL in case of man and less than 50 milligrams divided by DL in case of women, or taking medicine to increase HDL level. 5. Fasting sugar level of more than 100 milligrams divided by DL, or taking medicine to lower the glucose level. Though officially above 5 risk markers are used to identify metabolic syndrome, there are some other risk factors that can be sign of metabolic syndrome, such as high uric acid level, acanthosis nigricans, fatty liver, high BMI, obstructive sleep apnea, and fatty liver. In addition to these, women can have polycystic ovary syndrome, a condition of irregular period. Metabolic syndrome is also known as insulin resistance syndrome. So, what's insulin? Insulin is a hormone. Our pancreas makes it. It's insulin which helps sugar enter cells in your muscle, liver, and fat, where it's used as energy. Glucose comes from food we eat. When blood sugar rises after we eat, our pancreas releases insulin into our bloodstream to keep the blood sugar in normal range. Now the question is, what is insulin resistance? When you have insulin resistance, the cells in your muscles, liver, and fat don't react or take glucose from blood. This results in excessive sugar in the bloodstream. In a bid to regulate blood sugar level in the body, pancreas keep producing more and more insulin, and then a point is reached where it wears out and can't produce insulin anymore. As a result, blood sugar level in the body keeps rising and reaches diabetes range. If attention is not paid to, metabolic syndrome can lead to severe health complications like heart attack, stroke, diabetes, atherosclerosis, vision loss, kidney diseases, etc. The pattern of occurrence of risk factors in metabolic syndrome is not conclusive. In many cases, high blood pressure precedes high blood sugar level, while in some other cases high blood sugar crosses the limit first. There are other cases where patients just have high blood pressure with cholesterol issue. They don't have high glucose level. However, the interesting thing is that certain degree of atherosclerosis and inflammation are common both in diabetes and high blood pressure cases. Guess what? Both inflammation and atherosclerosis occur primarily due to type of diet we take. So, to tackle metabolic syndrome, you gotta make radical change in your diet. Inflammation and atherosclerosis are caused by high carb and high fats diet we take. Development of metabolic syndrome is further aided by sedentary lifestyle. Sedentary lifestyle refers to long period of physical inactivity, and a lifestyle that does not go well with body's biology. For example, if you don't sleep enough at night, you are depriving organs of your body to do their function effectively. Human body evolved with Homo sapiens doing lots of physical activities in the process of evolution. So, body won't function properly if you don't do physical activity. So, you can do regular exercise and find ways to use your limbs to engage in the most work. Take stairs instead of taking lift. Wash some of your laundry in hand instead of using washing machine. Walk to nearby grocery stores instead of taking your car. These simple change can bring a radical change in your health. Simply brisk walking for 30 minutes a day can help if you are not a fan of exercising. When you have metabolic syndrome, your food becomes a kind of your enemy. You'll have to be extremely careful with your food choice if you want to cure or reverse it permanently. Eat foods that have low glycemic load. Glycemic load is better tool than glycemic index in that glycemic load tells you sugar content of portion of a food you are taking. Avoid saturated and trans fat-rich foods like meat, refined and fried foods. Since carbs, proteins, and fats are macronutrients, the types of nutrients you chose is very important. 1. Complex carb foods such as whole fruits, vegetables, nuts, beans, and grains are ideal diet. 2. Unsaturated and polyunsaturated fats. Rich foods such as extra virgin oil, extra virgin coconut oil, nuts and seeds, fish, avocado, etc. 3. Proteins. The daily requirement is 0.8 gram per 1 kilogram body weight. If you weigh 70 kgs, 56 grams of protein intake is required. Physically active people may require more proteins. They may need 1.5 gm per 1 kg body weight. Fortunately, there are healthy sources of proteins available such as egg white, shellfish, quinoa, lentils, pumpkin seeds, Greek yogurt, etc. Basically, you will be avoiding fast food, junk food, added sugar, sucrose, fructose, vegetable oils, meats and poultry in your diet. Intermittent fasting has shown excellent result in reversing metabolic syndrome. Intermittent fast with minimum 10 hours eating window is good to being with. The lesser the feeding window, the better the result could be. 1 caution: don't go for dry fast when doing intermittent fasting. Dry fasting raises uric acid level and it can lead to serious gout problem. So, drink plenty of water during fasting period and eat foods low in purines during the eating window. When it comes to curing metabolic syndrome, you have no other choice other than radically altering your diet and leading an active lifestyle. Medicines can help contain, but it's matter of time you would require more medicines. Finally, a time will come when no medicine would work. The conclusion is everybody is going to die, but dying when time comes is more desirable than before the time. If you have any question or concern, ask me in the comment. I'm obliged to answer. Please subscribe. Thanks for watching.